Good morning. It's a beautiful day today, and a great time to have baby talk. Yesterday I saw some adorable pictures of baby AJ who just turned 3 months old. So today I want us to spend some time talking about your 3 month old baby and his or her development. Now, this is a significant milestone. In essence, your baby is like leaving the newborn stage and becoming an official infant. Moms and dads, you have done a great job so far, and your baby is moving along quite nicely. That means you can look forward to better sleep at night, because now your baby should have a regular feeding, sleeping schedule. And these fun milestones that you are going to see your baby achieve at 3 months old, it's going to be so adorable. Your baby should be doing some mini push-ups, some kicking and batting and toys, and making more advanced sounds, and even smiling. I know some of you have been seeing your baby smiling since he was 2 months old. But let's check in and see what we can expect of your baby, your 3 month old baby. I know you're saying, where did the time go? But let's see what Baby Center has to say about your 3 month old and his or her development. So, as I said earlier, you are exiting the newborn stage and officially becoming an infant. So, skills such as grasping for toys, grasping and holding on to those toys, will become more prominent at this point. Don't expect your baby to be able to grasp anything with precision, though, but they'll open and close their fist and bat at hanging toys. So get that mobile going so your baby can start to engage with more intent. Now, let's go through that hand control piece, because that is very important to me as an occupational therapist. In this month, your baby will begin to use the hands more intentionally, and you will see your baby AJ or Mary beginning to bang or bring the hands together and to the mouth and open and close the fist like a pro. So start using those hands. Put your hand in there and have him or her grasp your finger or your whole hand. Put a toy in the hand and let some activity happen. You're also going to realize that your baby has better eye-hand coordination. So all of the hand skill that is due to your baby's increasing eye-hand coordination means that your baby is able to coordinate the hand motion more smoothly to something that they see. Okay, so they're reaching the eye see, the hands go. And this is a very important skill for development and school success. Then you're also going to notice that your baby is doing some baby push-ups. Look for this. This is going to be so funny and interesting. And snap a shot as you see it. It might not be a full push-up, but they're able to raise their head and chest during tummy time. Tummy time, so all important. Tummy time, you're going to see those push-ups happening. And you want to keep your baby doing those activities. And he or she will get steadier and steadier as he progresses in achieving this skill. Now, let's look at leg strength. Your baby's leg strength, the toning of those torso muscles will begin to develop. And you want to watch and see that your baby is really stretching and kicking their legs when they're on their stomach or on their backs. And you want to place them on a solid surface so they're able to engage in these activities to build that leg strength for when walking time is, when they're ready for walking time, they're able to get up and do some walking. Isn't that fantastic? You're just really preparing and setting your baby up for success. Now, social smiles and babbling. I know you have been seeing your baby smiling. I've seen lots of smiling babies. But smile is going to become an easier thing for your baby to do as he or she hits that 3 month level or stage. You're going to hear more babbling sounds that are more adorable and more pronounced and more like ma, 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 ba, ba, ba. You hear those sounds coming from your baby and laughing. So you're gonna be tickled by the way your baby will laugh. As a matter of fact, I've heard some babies, even at 2 months old, bursting out in laughter. So look for more of that. I want you to be aware that in this month, your baby will be much more familiar with the people in his or her environment. In other words, your baby will begin to know who you are and know the objects that are in his or her environment. Okay, now look for your baby to achieve this master skill, the skill of rolling over. Going towards the end of this month, your baby should attempt to roll over. So look for that. Set him up, set her up so that they can do this skill. And then about 5 months old, your baby should start practicing how to do that roll over skill with finesse. Now, what should your baby weigh around this time? At 3 months old, your baby should probably have grown significantly since birth. In fact, your baby would have doubled it's his or her birth rate. So you're looking to see how your baby's weight is developing. And if your baby if you're wondering how much your 3 month old baby should weigh, you should be assured that your child's provider or doctor will make sure that your baby is growing well. But here is what you can consider. For boys, the average weight of boys at 3 month old should be 14 pounds 2 ounces. The average length of boys at 3 months old should be 24 inches. And if we are looking at girls' development at 3 months old, their average weight should be 12 pounds 13 ounces, and the length should be 23 inches, 23 and a half inches. Now, let's look at one or two more areas for your baby, 3 month old baby, in terms of feeding. How much should your 3 month old baby eat? Now, your baby will still eat quite frequently, but you can expect a more regular feeding pattern to emerge in this 3 month stage. Fewer erotic feedings at all hours of the night and day. And this is mostly due to the fact that your baby is now bigger and can eat more at one sitting, and so he or she doesn't have to eat so often. As a matter of fact, your baby should be able to eat every 4 to 5 hours instead of every 2 hours or every 3 to 4 hours. Okay, so this is such a wonderful, wonderful time for you and baby, as baby AJ, baby Henry, baby Jane has hit the 3 month old stage and officially become an infant. So continue journaling with your baby, continue reading, continue having those tummy times and playtime with your baby, those walks and taking pictures, so that together you and baby can develop and bond and have those wonderful relationships. Remember to take care of yourself. Take care of yourself. This is a relationship. And baby, although he or she is not able to verbalize, I know baby would want you to spend time taking care of you, as you spend so much time taking care of baby. This is Dr. Yonette. thanking you for joining me today for another Baby Talk. Have a great day.